welcome to our show, Health and Wellness, Myths versus Facts. The definition of health goes way beyond the absence of disease. The pandemic has put mental as well as physical health and wellness into sharp focus. Awareness of health issues is important for visibility and community. Just when you thought it was safe to go back to almost normal times, a new highly mutated variant of coronavirus has reared its ugly head in India. People with chronic diseases such as diabetes are prone to COVID, and it is obvious that this new variant too is dangerous for these people. Prevention is better than cure. If members of the public are aware of a disease and its symptoms, they are more likely to take action to prevent it from happening to them or go to healthcare providers for checkups. Also, chronic conditions like diabetes, heart disease, endocrine disorders come with complications associated with it. Hence, it's essential to identify symptoms early and take corrective steps. And expert advice will help you do just that. Joining us on the show today, we have Dr. Sachin Mittal, consultant endocrinologist, Fortis Hospital, Mohali, and Dr. Gopal D. Bhairupi Patil, consultant diabetologist, Nucleus Hospital and Research Center, Ahmednagar. Thank you so much, doctors, for taking out time and joining us on the program to answer all our questions. Dr. Mittal, first to you, what is Omicron, this new variant, and what makes it a variant of concern? And should people with diabetes now be very worried?
Yeah, thank you, Gargi. Omicron is a variant which has caused a lot of concern, and like any new variant, which basically means that come out with new mutations, there are three things which are important. First, is it more infectious, or is it more transmissible or likely to cause the disease? Second, is it likely to cause more severe disease, and do our existing therapies or preventive measures like vaccination work against it? Now, if you look at Omicron, for instance, it is clearly shown that with number of mutations, especially in the key areas, it is much more likely, sometimes 3 to 5 times more likely to be transmissible or likely to cause infections. But the silver lining is, it is likely to be causing less severe illness as compared to the Delta variant. Now, it may be early days, we are learning by the hour, but it also may be to the fact that the data that we have is more younger population, which tends to have a milder disease. But we need to make sure that our guard is not lowered and the precautions, the COVID appropriate behavior is continued. And yes, people with chronic illnesses like diabetes are more prone. It seems like that our existing therapies, whether you talk of vaccination, whether you talk of antibody therapies or other modalities of therapy, will have some degree of effect, but maybe not the complete effect. We will have more information in next few weeks' time. But maybe, that just is another food for thought, that maybe we need a booster or something to, make sure that our protection doesn't wane. But yes, there is no substitute for universal precautions. People who are susceptible, like you mentioned about diabetes, they need to be extra cautious. They need to make sure that the blood glucose levels are well controlled, their lifestyle is well taken care of. If other appropriate supportive measures are also taken care of, whether you're maintaining a active lifestyle or taking care of other factors like managing of comorbidities like hypertension, cholesterol problems, etc.
All right, and yes, we hope that the news remains the disease caused by, or the infection caused by this variant continues to remain mild. Dr. Gopal, can currently used diagnostics methods detect this variant, and will the existing vaccines also work against it?
Well, the WHO has classified this new mutant variant of the COVID-19 as B11529, which is a variant of the concern. Perhaps the variant of the concern is just because of the fact that there are multiple mutations which are noted in the virus. Near about more than 52 mutations has already been noted, out of which 32 mutations is in the spike proteins and near about 10 mutations in the receptor binding domain of the spike protein. So commercially available RT-PCR kits used to have target the three main portions, that is the S gene, which codes for the spike glycoprotein, E for the envelope, and N for the nucleocapsid. So if the RT-PCR test is positive, showing all the three domains like S, E, and N, then the test positivity is more likely to be secondary to the Delta variant. And if there is a S gene dropout, because the mutation is in the S gene, which is noted in the Omicron variant, and if there is a S gene dropout, then the positivity secondary to the E and the N gene is most probably secondary to the Omicron variant of the COVID, and that needs to be further evaluated by doing a genomic strategic approach. With respect to the vaccine, actually, as we all know that the vaccine targets the spike protein antibodies. So the vaccine which is already commercially available targets, it is basically from from the originally directed from the virus which was from the one variant. Now, as we all know that there are multiple mutations which are happening into the Omicron variant. So at this point of time, it is not clear whether the vaccine will definitely work or not against this Omicron variant. But yes, the vaccine, all the patients who are already been vaccinated, the infectivity, severity and mortality of a disease to a great extent is reduced by vaccinating the people. With respect to the transmissibility, I have already questioned it out, that the Omicron variant having a mutation of N501Y, this mutation is basically much more transmissible with respect to the other variants of the Omicron. And yes, the possibility, the transmissibility is very much higher with respect to the other Delta, Alpha, Beta or Gamma variant, but potentially the mortality is not as expected as it was with the Delta variant.
All right. Now, Dr. Sachin Mittal, could the Omicron variant of COVID be more transmissible? That seems to be, the indication so far. Final word is awaited. And what test should people with diabetes do to keep a check on their health?
Yeah. So as far as diabetics are concerned, it's back to the basics. Diabetes management needs to be done in a holistic manner, which means that we need to target not only the plasma glucose or the blood glucose parameters, but also other things. We also typically call it as a ABC approach. A for A1C, which means that HB1C or the glycosylated hemoglobin, which needs to be managed, ideally as close to normal as possible without causing low sugar, but at least a level of at least 7% or lower. B for blood pressure. That is, blood pressure needs to be maintained, if possible, less than 130/80, at the max 140/90. And C for cholesterol parameters, which means that the bad cholesterol needs to be lower and the protective good cholesterol needs to be on the higher side. And you can add a W to it, especially after COVID, like weight. So which means that the weight should not be more. We have seen that obesity increases risk of complications due to diabetes. We also call it a diabesity, which is a combination of diabetes and obesity, where the risks, it's like 1 + 1 and the risks increase exponentially. With obesity, the risks of severe COVID are much more higher. The risks of complications and the adverse outcomes due to COVID are much more higher. And when you put that in the mix of diabetes or in a diabesity and in a person having diabesity, that becomes even more problematic. So A, B, C, and W, which means that the weight should be managed to take care of, the other long-term complications like heart disease, kidney disease, strokes, paralysis, etc. But also to make sure that if you have a COVID, if your sugars are controlled, if your weight is managed, the chances of you staying at a normal phase is much more likely. At the end of the day, everybody has diabetes. Everybody has a normal sugar level, but when it becomes high in diabetes, it causes problems. So if we manage it using a sensible approach, which as a mix of lifestyle and appropriate medication after consultation with a doctor, then that things can be prevented, complications can be prevented, and it can be very well managed by, as we often call it, having a friendship with the disease, not trying to, run away from it and not trying to, hide from it.
All right, that's an interesting way of putting it, friendship with the disease. Now, Dr. Gopal, what is the HB1C test and why is it necessary to do this when the FPF and PPG blood tests are available?
Well, HB1C, as the name suggests, it is a glycosylated hemoglobin. So glycosylated means blood sugar level, and hemoglobin is basically a protein into the red blood cells of a human body. So when there is a glycation of a hemoglobin with the blood sugar level, this is called as glycosylated hemoglobin. The test gives an estimates of the blood sugar level, which is the average in the last 3 months. Even though we are having a fasting and the postprandial blood sugar levels, but there are multiple factors that contributes to the defect in the fasting and the post blood sugar levels. As of the patients having a last meal which is higher in carbohydrate content, you may have a fasting blood sugar level which will be elevated. The content of the diet, the patient having a stress at the point of blood sugar level checking. So there are multiple confounding factors. These all confounding factors are ameliorated by doing an HB1C test. Further, the test should be done for every diabetic patient and it needs to be done every 3 monthly. There is an UK PDS trial, which was a landmark trial in the history of the diabetes, who have already shown that the reduction in the HbA1c, even by 1%, can reduce the complications of all diabetes related complications by 30 to 40%. So it is a direct estimate that the patient's having any complications or not. So HB1C is basically an average blood sugar level for last 3 months, and it needs to be done in every patient upon diabetes.
Okay, Dr. Sachin Mittal, are the targeted glucose control levels for people with diabetes different for different age groups, and does the presence of diabetes complications and other comorbid conditions affect these target levels?
Yes, wonderful question. The blood glucose management is a personalized approach. It's not like one size which fits everybody, right? If somebody is of my age and having diabetes, I'll probably like to, look at a principle which was used in some other aspects of medicine called as ALARA. ALARA means ALARA, as low as reasonably achievable. By reasonably achievable means that without subjecting the patient to an unnecessary risk of hypoglycemia or adverse effects of therapy. So, with younger population, with large life expectancy, without any end organ damage, you're probably targeting a lower level. You can push the patient a bit more so that the patients live longer. At the end of the day, that's the same organs which are going to be there, whether you talk of heart, nerves, brain, and kidney. So the better we manage it earlier on, the better is going to be the outcomes in the long run. We also call it as a legacy effect, legacy. We leave it something for our next generation. So cells have a legacy. If our blood glucose levels are well controlled early on, we have a long-term good outcomes. If blood glucose controls are not well controlled early on, we have a long-term poor outcomes. Similarly, if somebody is having is age of 90, 95, already having a low ejection fraction, pumping of heart is low, or having multiple problems like heart disease, kidney disease, or existing stroke, etc. There, the first goal is to make sure that there is no hypoglycemia. That is, there is no fall in blood glucose level, because a low blood glucose level can be potentially catastrophic. It can trigger a cardiac event. It can trigger any other complication. It can lead to loss of consciousness, etc. also. So it's important for us to be, very realistic and appropriately manage the patient according to the underlying disease state of the patients. The age is one of the factors. Underlying conditions like other comorbidities, other organ damages, another factor, and then a lot of individual factors come into play over there.
Okay, Dr. Gopal, what is a continuous glucose monitoring system then, and what are the benefits of this?
Okay, this continuous glucose monitoring system is basically a system that automatically detects the blood sugar level every 15 minutes, at least for 14 days. So even though the patient is working, even though the patient is fasting, is in the postprandial, even though the patient is sleeping, it measures the blood sugar level all through. The important benefit of this is there is a concept of TIR, that is time in range blood sugar level. The concept is very well known in the diabetologists. This time in range is basically the amount of time the patient is spending within that speculated blood sugar levels, that is between the 70 to 180 blood sugar levels. So if we do a CGMS, the fasting, post, and all the blood sugar levels should be measured in the specified time. It can be used in a type 1 diabetes mellitus patient in whom the patient is having multiple fluctuations. The patient is experiencing a lot of hypoglycemic episodes. So all these factors will come to know exactly by doing this CGMS technology. We can get a lot of blood sugar levels within every 15 minutes. At what particular period of a time the patient is giving hypoglycemia, at what period of time the patient is having a hyperglycemia, and what are the fluctuations into the blood sugar level, because there are so many studies which have been already advocated that it is the fluctuations into the blood sugar level which can directly cause all the diabetes related complications. It is affordable for everybody because if you do a CGMS, that counts for only 1,200 rupees like that, and it gives the blood sugar level for at least 14 days. So it is very much affordable for everybody.
All right. We have lots more questions for the doctors on how to manage diabetes and also the risks from the emergence of this new variant, Omicron. We'll slip into a short break and come back with more. Welcome back. You're watching Health and Wellness, Myths versus Facts. We're talking about diabetes and the risks from the emergence of a new COVID variant. Let's go across to our doctors now. And Dr. Sachin Mittal, with diabetes, hypertension is one of the most common comorbidities. Hypertension control is equally important. With glucose control, does home BP monitoring improve hypertension control?
Yes. As I said earlier, diabetes management needs to be done in a holistic manner. And one of the pillars of diabetes management alongside good glucose control is blood pressure management. After all, a coexistence of both leads to exponential increase in complications. We know that high blood pressure can lead to heart disease. High blood pressure increases the of stroke, paralysis, adverse complications like kidney failure, etc., and even blindness, etc. And so does diabetes. So when the two of them come together, it's a double whammy. 1 plus 1 doesn't equal 2, but becomes more than 11. So it's extremely important to manage blood pressure levels. And just like a little bit of an elevation of blood glucose may not cause symptoms and may be absolutely insidious or silent, similarly, the elevation of blood pressure may not always cause you headache, may not always cause you difficulty or other symptoms related to high blood pressure. So that's why it's crucial to manage it. And a home BP monitoring really does help. Now, there are some things which we need to remember while doing home blood pressure monitoring. Typically, electronic instruments tend to have a little bit of a more variation. So how we advise our patients is we should do a monitoring of at least 2 to 3 times a day, ideally 3 times a day, 5 minutes apart at the same place, at the similar posture, and take an average of 3 readings and jot it down. It's an invaluable data set which does not require any degree of money to be spent. And just on the basis of this, it has been shown that if we manage our blood pressure and our blood glucose, along with lipid profile parameters in a good manner, along with active lifestyle, it goes a long way in preventing deadly complications or ameliorating these complications to a great extent. So as I said, try to be friendly with your disease. Try to make sure that you are on top of it. Don't react, but respond in a very calibrated, targeted manner so that, everything is taken care of it.
All right. Now, Dr. Gopal Patil, abnormal lipid levels are one of the major risk factors for diabetes and diabetes-related complications. So, which lipid abnormalities contribute to cardiovascular risk in type 2 diabetes mellitus?
Well, everybody needs to understand the importance of lipids. As Sarar already mentioned, the 3 important factors are A, B, C. A is for HB1C, B is for blood pressure, and C is for cholesterol. Actually, the cholesterol are the major, that is the lipids abnormality is the major contributing factor for the development of all diabetes related complications, perhaps all the micro and the macrovascular complications, which are essentially the component of diabetes complications. The complications like heart attack, stroke, amputation of the limbs are per se because of an increased blood sugar level along with the abnormal lipid levels. As we all know that the diabetes type 2 is basically because of an insulin resistance. So there is an impaired insulin secretion. This impaired insulin secretion or insulin resistance contribute for a lipolysis. Basically, insulin is a fat generating hormone, that is a lipogenetic, and its absence leads to lipolysis. So lipolysis means the fats are broken down. Though the fats are broken down, there is an increased amount of the cholesterol lipids into the blood circulation. So there are certain good cholesterol and there are certain bad cholesterol, as we all know. The good cholesterol is basically HDL cholesterol and the bad cholesterol is a LDL, that is low density lipoprotein, and a VLDL, that is very low density lipoprotein. And diabetes exactly happens the way that the good cholesterol is decreased, that is HDL is decreased, and the bad cholesterol, which is LDL and VLDL, they are increased. So this is called as a diabetic associated dyslipidemia, where both the cholesterol are reversed, which the cholesterol deposits, excess amount of the cholesterol does get deposited into the blood vessel. It damages the endothelium of the blood vessel and leads to all the diabetes related complications. So we need to be very much keen to keep our lipid level within the speculated and the normal ranges so that we should not have, the patient should not suffer from all the diabetes related complications per se.
All right. Now, Dr. Mittal, can low sugar cause serious consequences in people with diabetes, and how can this be prevented?
Yes. So hypoglycemia or low blood glucose levels can be catastrophic, potentially life-threatening also. There can have the first aspect is recognition of low blood glucose levels. It can have symptoms like, say, a lot of sweating, disorientation, drowsiness, even loss of consciousness. It can cause seizures. It can trigger and number of other things. So important thing is to recognize these complications. Every diabetic should be made aware of that. If there are some symptoms like that, ideally the blood glucose level should be tested with a home glucose glucometer. If the levels are less than 70 milligrams per deciliter, or say 80 milligrams per deciliter in an elderly, we should take something, we call it a 15 grams of quick release sugar, which can be, say, a glucose powder, or say a juice or a cold drink or something like that. So, which causes a quick rise in blood glucose levels. Recheck after some time as the blood glucose becomes normal. It's important to follow that up by a complex carbohydrate, because otherwise what will happen, a sugar or a juice will cause a temporary spike, but it may again come back. That is step one. What is step two? Why did it happen? How can we prevent it? So there are two factors. Is there a problem in terms of diet, or is there a problem in terms of therapy? And sometimes there are associated things which come into picture, we associate illnesses which can cause that. So in terms of diet, it's important that our diet is calibrated. The patient should not be, on medications which cause the blood sugar to become low. And at the end of the day, the patient is not eating or fasting for a prolonged period of time that can cause blood glucose levels to fall low. So the treatment needs to be optimized. The diet needs to be optimized for the patient. And that must be done as soon as possible after immediate treatment in consultation with the concerned endocrinologist for the patient. And also it's important, if there is repeated things are happening, is there any other illness which is contributing to it? So please do a thorough evaluation for that, so that these kind of events can be prevented at all. Sometimes people do not have a low blood glucose, but have feeling like a low blood glucose. That happens, say, if my sugar I'm used to sugar of 300, and because of treatment, my sugar has become 120, I might have the symptoms because my brain is used to 300 now. At this point of time, if I take sugar, it will again go back to 300. So that's important to check it before we take sugar. And if it is frankly low, only then we take it.
All right, so interesting to know the risk there of low blood sugar. Well, thank you so much, doctors, for joining us on the program and answering all our questions for us. Thank you all for watching at home. Goodbye.